Ibupak 600 mg oral kit is a non-steroidal anti-inflammatory drug, Nsaid, and salicylate. It is used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibupak 600 mg oral kit works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Always check the ingredients on the label, even if you have used the product before, as the manufacturer may have changed the ingredients. Also, products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. It is recommended to take Ibupak 600 mg oral kit with food or milk to help prevent stomach upset. Always follow your doctor's dosage instructions and do not take more than recommended. Be sure to take it at the same time each day for the best results. When taking Ibupak 600 mg oral kit non-steroidal anti-inflammatory, Nsaid, and salicylates, it's important to follow the directions carefully. If it's an over-the-counter product, be sure to read all the directions on the package before taking the medication. If your doctor has prescribed it, be sure to read the medication guide provided by your pharmacist before starting and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth, usually every 4 to 6 hours with a full glass of water, unless directed otherwise by your doctor. It's important not to lie down for at least 10 minutes after taking the medication. If you experience stomach upset, it can be taken with food, milk, or an antacid. The dosage is based on your medical condition and response to treatment. To reduce the risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often than directed by your doctor or the package label. For ongoing conditions such as arthritis, continue taking this medication as directed by your doctor. For children, the dose is based on the child's weight. Be sure to read the package directions to find the proper dose for your child's weight. Consult the pharmacist or doctor if you have questions or need help choosing a non-prescription product. It may take up to 2 weeks of taking this drug regularly until you get the full benefit for certain conditions such as arthritis. If you are taking this drug as needed, it's best to use it as the first signs of pain occur to maximize the effectiveness of the medication. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help right away. If you are using the non-prescription product to treat yourself or a child for fever or pain, consult the doctor right away if fever gets worse or lasts more than 3 days, or if pain worsens or lasts more than 10 days. Some common side effects of Ibupak 600 mg oral kit may include upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness. If any of these effects persist or worsen, consult your doctor or pharmacist. This medication may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if it becomes elevated. Serious side effects may include easy bruising/bleeding, changes in hearing, mental/mood changes, signs of kidney problems, vision changes, symptoms of heart failure, or symptoms of liver damage. If you experience any of these, seek medical help immediately. While a serious allergic reaction to this drug is rare, it's important to be aware of symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek medical help right away. Remember, this is not a complete list of possible side effects, so if you experience any other unusual effects, be sure to contact your doctor or pharmacist. Non-steroidal anti-inflammatory drugs, like ibuprofen, may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. This risk may be higher for older adults or those with heart disease, high blood pressure, or diabetes. It's important not to take this drug right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines, which can occur without warning. Older adults may be at higher risk for this. If you experience stomach/abdominal pain, black/tarry stools, vomit that looks like coffee grounds, chest/jaw/left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, stop taking ibuprofen and seek medical help immediately. Before taking this drug, it's important to talk to your doctor or pharmacist about the benefits and risks. Before taking Ibupak 600 mg oral kit, it's important to consider any allergies you may have to ibuprofen, aspirin, or other NSAIDs. It's also important to discuss your medical history with your doctor or pharmacist, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or intestinal problems. Kidney problems can sometimes occur with the use of NSAID medications, so it's important to stay hydrated and monitor your urine output. This medication can also cause dizziness or drowsiness, so it's important to avoid driving or using machinery until you know how it affects you. It's also important to limit alcohol and tobacco use, as they can increase the risk of stomach bleeding. Additionally, this medication can make you more sensitive to the sun, so it's important to limit sun exposure and use sunscreen. It's also important to discuss the use of this medication with your doctor if you are pregnant, planning to become pregnant, or breastfeeding. When taking Ibupak 600 mg oral kit, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. This medication may interact with other drugs such as aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, and water pills, diuretics, which could increase the risk of bleeding when taken with drugs that also may cause bleeding, like antiplatelet drugs and blood thinners. It's important to carefully check all prescription and non-prescription medicine labels, as many medications contain pain relievers and fever reducers that are similar to ibuprofen. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking the aspirin unless instructed otherwise. However, daily use of ibuprofen may decrease aspirin's ability to prevent heart attack or stroke, so it's important to talk to your doctor about using a different medication to treat pain and fever. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen, and be sure to take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Always consult your doctor before increasing your daily dose of aspirin or changing the way you take aspirin or other medications. If someone takes too much Ibupak 600 mg oral kit and has serious symptoms like passing out or trouble breathing, they should call 911 immediately. Otherwise, they should call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, trouble breathing, and extreme drowsiness. If your doctor has prescribed Ibupak 600 mg oral kit non-steroidal anti-inflammatory, NSAID, and salicylates, it is important not to share it with others. Your doctor may require you to undergo lab and/or medical tests, such as blood pressure and kidney function, while taking this medication. It is important to attend all medical and lab appointments as scheduled. It is best to consult your doctor for more details on these tests. If you are taking Ibupak 600 mg on a regular schedule and you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, skip the missed dose and take the next one at the regular time. Do not take a double dose to make up for the missed one. It's important to take this medication consistently for the best results. It's important to store Ibupak 600 mg oral kit at room temperature, away from light and moisture. Remember not to store it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of the product, make sure not to flush it down the toilet or pour it into a drain unless you are instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.